Welcome back to Sunday Breakfast right here on ChannelOne TV. Just gone by a conversation with Reverend Cephas Haywood Amate on responsible parenting, right? And helping us with some insights into that conversation. But for now, we delve into our health segment where we focus, more like a continuation on our series on breast cancer. This time around, focusing extensively on the complications around breast cancer. But a couple of your messages have come through. Keep them coming. Hamza, I've seen yours. Akoto Gameli, who is watching from Infancy-Man Girls. Interesting. I've seen your message as well. So as Enoch AJ. Just keep them coming. We'll read all of it. The big question we are asking really is, what do you make of election crowds, right? And whether or not they translate into votes. If there's any other issue you want to talk about as we go ahead with the show, feel free to send your message. The health segment is also live now. If you have a message, 0204-447-033. Doc Kalsum, Zakaria Adam is my guest. Doc, welcome.
Thank you.
I offset, I was asking you whether you had a good week, and your response really gave you out. Your smile gave you out. So whatever good things is happening, please share with us. Yeah, you have to share with us.
I would always say I have a good week when possibly when I look at my to-do lists and I have been able to do about 90%. That's a good week for me.
Wow. We'll talk about breast cancer shortly, but talk to us about the joy really when a patient walks in very helpless, in a very bad state,
okay,
and now seeing the patient like recover and walking or going out of the, what does it feel like for a medic?
It's really a good feeling actually, because it helps you know that yes, some of the things that you are doing is actually reaching out to people. Because when people come in and they are helpless, and even sometimes just the smile on their faces when you go for a morning ward round compared to the first day they presented,
can imagine.
It's very refreshing, and it's only reminds you of the fact that you are actually doing something, and it's encouraging. It encourages you to want to do more and want to be able to at least also give part of, or even the oath that you have taken, you're living up to it, and people are getting better day by day.
Oath?
Exactly,
I've
the
always
Hippocratic
wondered why it's called the Hippocratic oath.
Maybe some other day should lecture us on the tenets of the profession.
Sure, definitely.
But someone said,
Some of the gentlemen in this office.
Okay.
So you've been preaching breast cancer. This is the fourth week we've been preaching breast cancer.
Yeah.
And we had the opportunity to be screened. Ask me how many of them got screened.
What is all this?
How many of them?
I literally had to beg. This one he didn't go. Don't even do it.
Really?
But that is not true. That is
I'm
not true.
heartbroken.
No, Doc, I won't break your heart, but I went. Let me just be frank with you. So I went.
Okay.
And they did that thing, but they didn't do it well. So I had to go back.
How did you know that they didn't do it?
That's the same thing I'm asking him.
Tutoring you have gotten from this? Is that what made you think that it wasn't that well?
Some things are inarticulate. They have to be said off record. But the point is that I just know that I have to go for it again.
Really?
Yeah, I'll go and get it checked again.
But you know how to do it yourself.
Yeah, I know how to do it myself.
Okay, from what
but even that
we have
one,
been
some way.
discussing.
Yeah, but
I think we should rehash on that as we get into our conversation.
Very well. But Doc, we are very, we are fully behind it. We are supporting the breast cancer awareness month.
You're asking people to get screened because you have the opportunity to get screened and then you're not doing it.
Don't do this.
But I'm happy. I'm happy that at least most of you got screened.
And thank you so much too. Thank you so much.
For the advocacy, for the education and all of that.
Somebody said that, the reason why God didn't keep angels on earth was because doctors were there. And it resonates with that a lot. So
we are humbled.
Thank you for all the work that you do.
Okay, so
That's
getting
humbling.
into our conversation, I think we should just rehash for Jude's sake.
And what's the meaning of this?
How to do your own screening at home, and maybe a bit of what we've discussed, the symptoms and the signs.
Yes. Okay, all right. So we'll start. So over the week, or over the past weeks, we have spoken about what breast cancer is, and I'm sure all those who have been following us so far, they know exactly what breast cancer is. As at least once breast cancer is mentioned, you know that it has to do with the breast tissue becoming cancerous and dividing uncontrollably, and then it can also move to other parts of your body and then give you other signs and symptoms related to it. And we spoke extensively about the signs and symptoms associated with breast cancer. We mentioned that some of the signs could be that you can have some bloody nipple discharge. You can have abnormal shapes of your breast, which is not usual. And then you can end up having a lump within the breast that may not even be obvious, and there can also be some skin changes around the breast. So when you look at the breast, you realize that there could be some rash, a reddened patch, or there could be even an ulcer or a sore around the breast. And all of these could be some signs and symptoms associated with breast cancer. And then we went on to talk about the risk factors associated with breast cancer. We mentioned that the most important risk factors are usually you being your sex, being female, even though we have about 0.5 to 1% of breast cancers happening in men as well. And then the fact that you are aging, so anybody who is 40 years and above is at risk of developing breast cancer, even though certain studies that have been done here locally also show that people get breast cancers even at 35 years old. And then we mentioned that smoking, old friend smoking, is also a strong risk factor for developing breast cancer. Family history of breast cancer, and then having early menopause as well. They are all having rather early menarche as well can also predispose you to getting breast cancer. And then we went on to talk about how to do your self-breast examination. We mentioned that it's important that once you are 20 years, reproductive age, you should start doing your self-breast examination. You learn how to do it and then do it effectively and then do it correctly. So it's advocated that at least you do this self-breast examination once every month, 7 days after your menses. And then if you are postmenopausal, it means that you would have to take a particular date within the month and then stick to it throughout the year and then have your breast checked. So I suppose that most of us have done about 10 self-breast examinations as we are in October now.
We've done some.
Yeah, and then we mentioned that for you to do a self-breast examination, you'd have to first observe or look at the breast. So you need to get naked from your waist all the way up, and then you stand in front of a mirror, and then you're looking for, are there any skin changes that we have discussed? Are there any, is there any nipple retraction? The nipples are not pointing in the directions they are supposed to be pointing.
But I thought people's nipples point
outwards.
And some people also have inverted nipples, right?
Yes, so if from birth you have inverted nipples, then that's okay.
Okay.
Then that is normal. There's a little percentage of people who have, their nipples inverted. That's fine. But then I'm talking about the fact that you already have, from birth, you already have your nipples pointing outwards. And then for some reason, one of it is now pointing in another direction as opposed to the other one. Then it means that there's something that is happening. There may be a lump that has developed that is holding onto the nipple and then causing it to retract inwards. So that is what we are talking about. Even when it comes to the size discrepancy, people tend, it's not that you have the same size of both breasts, but then if you have this discrepancy that is very obvious, that is what we are talking about. In terms of shape, some have a little, the shape is not exactly as the other. It's not a mirror shape of the other. But then at least if you notice a sudden change such that the shape there's gross difference in the shape, that is what we are talking about. So these are some of the things that we mentioned, that you look, and then you check the shape, the size. You also look at the skin, and are there any changes around the skin? Is there any rash? Is there any patch around the skin? Does the nipple, as I said, look retracted? Or do you have something that we typically call, that's the peau d'orange? It looks like the peel of an orange. So just like we all know how the orange looks like, so the peel of an orange, if you look around the skin of your breast, if you can see any of these. Or even sometimes, as I mentioned, typically, if you have pain raising your hand, or putting your hand in function, or if you have swelling of the upper arm related to the breast, or is there any another lump or a swelling within the armpits as well. So we mentioned all of that. You are looking. After looking, the next thing would be that you would want to palpate. So palpation is just you pressing or massaging your breast tissue against your chest wall. So as I mentioned, you don't need to do your palpation by holding the breast this way. Okay, otherwise everybody will think that there's a lump in there. Okay, so you need to do it against the chest wall, which is a hard surface. So once you palpate the breast tissue, you divide it into 4 through the nipples, and then you start palpating each quadrant. So you palpate, and then you are checking, are there any abnormalities, especially any hard lump within the breast, and then you go all the way till you exhaust all the quadrants. And then the next thing would be that you would want to check your armpits as well. So you check every part of the armpits if there is any swelling or there is any lump in there as well. Once you have finished that, then you want to express your nipples. So you express the nipple in 2 directions, both the horizontal and then the vertical direction, and then you check for any discharges, the abnormal discharges, and this should actually end your self-breast examination. And as we have mentioned over the week, we have mentioned that aside doing the self-breast examination, if you are 40 years and above, you should be able to do the clinical breast examination as well, and that should be done in the clinics. So you go, once you are 40 years and above, you go there for breast examination to be done for you, and then you start doing your annual mammograms at age 40 and above. But it's also advised that you can do these mammograms once you have family history of breast cancer. Breast cancer, cervical cancer, any of those cancers, once you have family history, it gives you an extra risk of developing breast cancer. So once you are examined, would give you a particular schedule which will be much earlier than the regular 40 years that we are talking about. So if you do have any family history, don't wait till 40 years before you start screening clinically and doing your mammograms, but you need to come in earlier, and we need certain information as to when the family member had the diagnosis of the breast cancer, and that would help us know when you should start your screenings early. And yes, so we spoke at length about all of these, and today we would want to delve more into some of the complications.
Yeah. So yeah, I guess we can just go inside. What kind of complications present itself if I have breast cancer?
Complications of breast cancer, we would say that it has to do with the diagnosis of the breast cancer. So from diagnosis to treatment, all the way to even recovery. So there are certain complications that you may have along the line. But we would want to talk about untreated breast cancer, because we always say that once you are diagnosed with breast cancer, it's a hard blow, and people think that it's a death sentence.
Yeah.
And really it isn't, because if you are going according to the schedule and doing your self-breast examination, you should be able to catch it early. Once you catch it early and you come in early and investigations are done, chances are that you will actually be cured of
Early
the breast
detection
cancer.
saves lives.
Early detection really does save lives. But people wait, even when they are diagnosed, just the news or the fact that they know that they have breast cancer, they tend to wait and they don't come out. They don't come back and follow up with treatment. If they don't, the more you wait, it means that you are given the tumor the chance to multiply, to grow, and start moving to other parts of your body, which we call metastasis. So it starts to move to other, and then that will mean that your treatment now becomes a little much more complicated compared to when it's early disease. So where does breast cancer metastasize to? Where does it travel to? So it can move to your lungs. That's the most area that it can move to.
Is
so it can
because
move
it's
to your
close
lungs. Exactly.
to the breast, okay.
It's just on the chest wall.
Yeah.
So it can move directly there to your lungs. And when it moves to your lungs, you tend to have something we call pleural effusion. So pleural effusion is when you have water within the lungs. So imagine where you are breathing and then you have water around the pleural cavity. So it tends to reduce your lung function, and then it becomes difficult for you to even breathe. So most people who have lung metastasis with pleural effusion, you know that we are very unhappy about it because it becomes very difficult to treat. So that's one of the main things, the areas, one of the main complications of breast cancer. And these patients will not only have this pleural effusion, but they tend to have a lot of pain associated with it. So it doesn't only go to the lungs, but then it also goes to other surrounding bones.
Yeah.
You get it? And it means that once it goes into your bones, it compromises on the integrity of the bone. The bone, what does the bone do? It gives us strength. It helps us, let's say it goes to your lower limbs. It helps us to be able to carry ourselves around. But then once there is tumor affecting the bone, it's going to affect the integrity of the bone. And then it predisposes these patients to what we call pathological fractures. So the bones can just fracture with the least pressure. Okay? A bone that you could have walked on and then assaulted with all the weight that we usually do, locomate. But once this bone is affected with the tumor cells, what it does is that it tends to cause something called resorption, bone resorption. And then with time, you tend to have higher levels of calcium within your blood, and that also comes with its own complications, and then affects the bone that itself that is affected. And this bone would end up fracturing with the least mechanical force that it is assaulted with. So one of the complications is you are prone to getting pathological fractures once it affects your bones. And then if it gets to your lungs, there's pleural effusion in there. It can also metastasize to your liver, that is your abdomen. And we know that the liver is a very important organ in our body.
Right.
It does all the detoxifications for us. It also helps with some regulation of your metabolism in your body. So it helps some cells to produce your sugars, and then you are able to metabolize and then all of that. But then imagine the tumor cells affecting the liver, it means that anything you take in, you are going to have a hard time either detoxifying it or even when it comes to your metabolism. So patients who have lung metastasis end up coming very sick.
Wow.
So either the abdomen there's some ascites, and then the abdomen is filled up with some fluid as well, or they tend to have something we call jaundice or yellowing of the eyes.
No, talking about
well.
the complications, there's this message here. The message says, Jude, I want you to ask Doc about fluids around the breast even when you are not breastfeeding. Could that be a possible sign of breast cancer?
Okay, so I'm sure the person is talking about some fluid coming out of the breasts, even though the person is not breastfeeding.
Yeah.
So we need to look at that, not entirely. So once you think that there's some fluid or discharge from the nipple, you need to examine it properly. What time of the month are you in? There are certain times within your month, maybe some ovulation of some sort. You may tend to have some fluid, but that's very scanty. So once you have blood-stained nipple discharge, that's what we are talking about.
Okay.
And then also, that may come with other signs and symptoms that we spoke about. That's maybe a lump or some skin change of some sort. Yes, so these are some of the things that we are talking about.
But is it possible to, forgive my ignorance here, sorry, is it possible to be milking even when you're not breastfeeding?
No, because you need, so lactation has to do with signaling. So the body would need to know that, okay, a baby had been born, and that is all, it all has to do with your hormonal balances. Okay. So the body, it's a coordinated thing that, okay, this baby had, and then it's also the sucking effect also tells the brain, and then the whole signaling starts for the lactation. Yes, it's all hormonal. So it has to be there for you to, but once it's not likely that you'll be lactating unless there is some hormonal imbalances here and there, and then you have prolactin being produced, which is the main hormone that controls lactation. So very unlikely.
It's interesting. So,
right. But that's, you were talking about, is that what we call the lymphedema?
Lymphedema, yes.
Lymphedema.
No, lymphedema is actually the when you have blockade of the lymph nodes that are within your axilla or your armpits, such that it's not able to filter the lymph that is supposed to drain the upper limb. So that's when you end up with, you remember I mentioned that you may end up having difficulty raising your arm, and then there's swelling of the upper arm. So that is what we call lymphedema. So lymphedema affecting the upper arm most of the time is related to the breast. But you can have lymphedema associated with the lower limb or any other part of the body as well, depending on where the lymph nodes that drain that part of the body is blocked. You get it? So once there's breast cancer affecting the axillary lymph nodes, that is what drains the breast. Yes, and they are blocked. You can end up with lymphedema of the upper limb, which is also another complication that we were going to talk about. And this lymphedema could actually even happen as a result of treatment as well. Remember I mentioned that these complications run or span from diagnosis, treatment, to even when you are recovering. So you may end up having lymphedema as well once surgery has been done and axillary clearance has been done. And the reason is that you would have removed or cleared all the lymph nodes that do drain the upper arm. And it will take a little time throughout your healing process for new channels to be established, so that now your arm would be. So it's one of the things that you need to talk to your patients about, all those who are going to have surgery and have some axillary clearance as much as possible, so that they understand and they don't get alarmed when it's happening. Yes. And another complication that we would want to talk about is, aside the liver that we were mentioning, and that you may end up having some signs of you having yellowing of your eyes, which we call the jaundice, because of ineffectivity of bowel drainage through the whole system, through the hepatobiliary system. The other thing that we want to talk about is the fact that if there is metastasis to the brain, it can also end up causing cognitive dysfunction as well. So you know that your brain is what controls almost everything. So if you have some of the tumor cells traveling to the brain, you end up having signs and symptoms associated with the functions of the brain. So the functions of the brain will be compromised as well. And then other things could be that it could lead to you having certain bleeding disorders as well. So you may end up, it predisposes you to having clotting. Your blood can clot. Your blood can clot in a way that is not usual because of the tumor cells. So the blood is supposed to be flowing,
right?
You know, and then if these tumor cells are in there, it predisposes you to what we call hypercoagulable state. The sense that now your blood within the vessels or within the tubes can end up becoming clumps.
So is it clotting in specific areas, or it can happen?
It can happen in any part of your body.
Oh, wow.
Because of the tumor cells. It predisposes you to the hypercoagulable state, and this hypercoagulable state will mean that wherever that you find maybe some inflammation happening within your body, you can end up having clots there. And if these clots are not gotten, or these clots are not identified early in life, it means that these clots, if they do dislodge and then they move to other areas, especially when they move to your pulmonary vessels, then that becomes very dangerous. Then you can end up with a PE, which is pulmonary embolism, and that is quite fatal.
Right.
Yes. So some of these complications are very, very, they can lead to your death. So it's important that once you are diagnosed, please make sure that you go through the processes and then the right treatment is given. Otherwise, some of these complications may happen if you do not have treatments that have been scheduled, done at the right times. And the other thing I would want to talk about is depression.
I was about to say the psychological effects from when you're diagnosed to, you know, that whole process, treatment, and even after treatment.
So depression and then anxieties. People are anxious. I've been diagnosed. I've been told that I need a mastectomy. I need to have this breast taken away. How am I going to be? How am I going to take it? How is my spouse going to take it? How is society going to see me? Do I become less of a woman? All of these are things that people tend to think through. And I'm happy that the diagnosis of cancer is a multidisciplinary approach where you have all stakeholders that would help you throughout the treatment present. So you have a psychologist on board who would speak to you at length to allay all your fears. So that if there are, at any point in time, if we think that you are getting depressed, you are given the right treatments. All your anxieties are spoken to, so that you are assured of the fact that once you have been diagnosed of breast cancer, it doesn't mean that it's a death sentence. Treatment is available, and the emphasis is early detection saves lives. And there are a lot of survivors who are out there who are even adding their voice. They have formed support groups. I mentioned it here the last time. And I think it's so effective because they help in talking to some of these patients, and then they are able to convince them to go through the treatment, because they know that they who are speaking to you have gone through, they have walked that path before. So it's possible that they would also get the needed attention and the needed cure that they do actually.
Doc, there's a question here for you. Good morning. Please ask Dr. Adam whether one is at risk when they wear bras. I'm asking because some bras have metals in them, and there's a trend of these silicone bras. Are we safe? That's the
okay. All right. So bras, from literature and from what we know, it has nothing to do with breast cancer, development of breast cancer. It has nothing to do, whether it's metallic. Some people even say that you putting money very close to your breast has no. So we don't have any documented literature or articles to state for sure that these have risk factors associated with you developing cancer. So it's a no. It's one of the myths actually that I have seen, that we are trying to make people aware of the fact that it's not true. That once you wear bra, some people say that the length of period that you wear your bra, yes, sometimes 24 hours wearing your bra for 24 hours, but I don't think any woman wears a bra for 24 hours unless maybe you are on duty and it's a 24-hour duty. Otherwise, definitely you would have to take them off at least for some 8 hours or even 4 hours. And that has nothing to do with development of breast cancer. And then even silicones. No, silicones too, there's nothing written about it. Silicones rather are usually the materials that are used for breast reconstruction. Yes, so it has nothing to do with you.
It's interesting because there's, and shout outs to our Twitter followers, right, who are watching. So this message, I can't mention the handle on air, but he wants to find out if there's a correlation between cancer and the use of body enlargements, BBL, they call it.
Okay.
So is there any correlation whatsoever?
So far, no, there isn't. It's the only thing that I have mentioned are the usual risk factors.
Okay.
Being female and then having some of these other risk factors that we have mentioned, but nothing to do with the
Body enhancement
BBL exactly,
and
and then you having to take fat from one part of the body and then placing it on the other part of the body. It has nothing to do. The only thing is that the documented risk factor is rather obesity. So you being obese, and I mentioned this I think last week.
Yeah, I remember.
You having to know your numbers, your BMI,
your body mass index.
Exactly. So those are the facts, some of the written facts that have gone through research that it has a risk with you developing breast cancer, but not you liposuction, removing fat from one area to the other. So it has nothing to do with that. Yes.
Right. Thank you so much, Doc. We've learned a lot this past
4 weeks.
4 weeks.
Yeah.
October.
So I'm sure everybody should have done their self-breast examination properly.
And know how to do it, because I
and know how to do it, because you have to be doing it
every
month. You would have to do it every month.
Every
Yes,
month.
and then once you are in the reproductive age, make sure that you do it 7 days after your menses every month. And then if you are post-menopausal, you take a particular day within the month and then stick to it and make sure that you are having your self-breast examination. Is very important because you would be able to catch some of these lumps very early and then have the right treatment given. So let's all remember that breast cancer diagnosis is not a death sentence, and the early detection really does save lives. And no one should battle breast cancer alone.
Thank you very much.
Thank you so much.
Well noted. I'll take Jude to get his screening done shortly.
Yes, he has to.
Why are you doing this?
Well,